Welcome to the Oh No, My Blood Sugar is Low presentation, Learning More About and Understanding Diabetes. This is part 3 of a 3-part presentation on diabetes. This training is provided by American Way University. Once again, my name is Angie Danielski, and I will be your guide during this training. Please note that you should have viewed parts 1 and 2 of the presentation prior to starting part 3. Here is an overview of what part 3 of the Oh No, My Blood Sugar is Low presentation, Learning More About and Understanding Diabetes will cover. First, we will explore what you as a caregiver can do to assist residents who live with diabetes. Next, we will review 2 sample orders for what to do when someone has hypoglycemia, or low blood sugar. For those who have been diagnosed with diabetes, there are things that you as a caregiver can do to help the resident live a healthy lifestyle. Checking blood sugar levels regularly is the most important thing that a person or caregiver can do. Usually a doctor will prescribe a certain number of times a day a diabetic person should check their blood sugar, or that the caregiver should check the blood sugar for the resident. Oftentimes, blood sugar is checked before meals and at bedtime. However, for some residents, blood sugar may only be checked once a day. Taking insulin and other medications as prescribed, such as oral anti-diabetic agents, is another important way to help control diabetes. A person may be prescribed more than one type of insulin or more than one medication for diabetes. Administering these medications as ordered and on time is very important in helping control blood sugar levels and reducing the risk for developing complications. Knowing the symptoms of hypoglycemia, or low blood sugar, is also another important measure for diabetics, their families, and caregivers. Caregivers often spend the most time with residents, so learning these symptoms can help a resident avoid problems associated with hypoglycemia. Common symptoms of low blood sugar include hunger, shakiness, sweating, dizziness, sleepiness, confusion, anxiety, and weakness. Low blood sugar can occur at any time of day. However, most often hypoglycemia will occur before meals or overnight. It is important to know what to do if someone has a blood sugar level that is below 70. Individuals with diabetes will often have doctor-prescribed orders for what to do if someone has low blood sugar levels below 70. However, residents who normally have a higher baseline blood sugar might start feeling symptoms at a blood sugar level greater than 70. For example, if a resident normally has a blood sugar level that runs around 200, he or she might start feeling symptoms of hypoglycemia if blood sugar is at a level around 150. Getting to know your residents is important to help them live a healthy lifestyle and help manage their diabetes. Knowing your resident and what level they start to feel symptoms is important to help further illness or injury. Here's an example of doctor's orders for what to do if a resident is experiencing symptoms of hypoglycemia. Remember, hypoglycemia usually occurs when blood sugar levels are less than 70. However, as we learned in the previous slide, symptoms of hypoglycemia may occur at levels above 70 for those residents who normally have a higher baseline blood sugar. This would be an order found in the Medication Administration Record, or MAR. Please ensure that you are referencing the most recent MAR and that it is up to date for the resident you are assisting. If you have any questions, please check the orders with either the pharmacy or the prescribing physician or other healthcare provider. If a person is alert and able to swallow, give the person orange juice immediately. Orange juice is a quick source of simple sugar to help elevate blood sugar levels in the blood. Blood sugar should be rechecked after 15 minutes to ensure blood sugar levels are rising. A resident should also be given complex carbohydrates to help sustain blood glucose levels. A good source of complex carbohydrates is peanut butter on crackers or toast. If a person is not alert and is confused or unconscious, call 911 immediately. If the person does not get help, a coma or death could occur. Stay with the resident until EMS personnel arrive. Here is a second example, which is slightly more complex than the first, for what to do if a resident is experiencing symptoms of hypoglycemia. Again, this order would be found in the MAR for a given resident. This example will be over 2 slides. The first slide of the 2 contains the orders for what to do when a resident is alert and able to swallow. If the person is alert and is experiencing symptoms of hypoglycemia, give the resident 1 glucose tab. These tabs are chewable to help speed up absorption. However, they may be crushed if the resident has difficulty chewing. Blood sugar levels are then rechecked after 15 minutes to ensure that the blood sugar level is rising. If the blood sugar is not above 70 after 1 glucose tab, the resident should be given another glucose tab. The process of repeating the blood sugar after 15 minutes and giving additional glucose tabs is repeated until the blood sugar level is above 70. Once the blood sugar is above 70, a resident is given a source of complex carbohydrates. Again, peanut butter on crackers or toast is often a good source of complex carbohydrates. The next slide will cover what to do when a resident is not alert, cannot swallow, or is unable to follow commands. If a person is not alert or able to swallow with a blood sugar level of less than 70 or experiencing symptoms, glucagon 1 milligram in 1 milliliter is given via intramuscular injection. Please note that caregivers must be trained and delegated by a registered nurse to give IM injections. Only staff that have had this training and delegation should administer glucagon. If a resident is not alert and you are not trained and delegated to administer glucagon via IM injection, call 911 immediately. 15 minutes after giving the glucagon, blood sugar levels should be rechecked. If the resident becomes alert, caregivers should move to the section for alert residents for direction. As a reminder, in this example, if the blood sugar level was above 70, a source of complex carbohydrates would be given. If the blood sugar was below 70, the sequence of giving glucose tabs and rechecking blood sugar would be followed. If a resident is still not alert after being given the glucagon, caregivers should call 911 and stay with the resident until emergency personnel arrive. This concludes Part 3 of the American Way University training of, "Oh no, my blood sugar is low," learning more about and understanding diabetes. Thank you for your participation. You have now finished the entire course. For further training opportunities, please visit our website or feel free to call our office. Once again, thank you for viewing this presentation, and I hope that you learned a lot.